Hey, everybody. Good evening. This is Nurse Eunice with Florida Training Academy, and I do apologize for a delay. I have been having some major technical issues, but we're going to get started shortly with tonight's Wednesday night live. We're going to do 100 practice CNA exam questions to help you pass your examination. So, yes, hello, is it Kirk? Hello, everybody. I thank you for your patience. And so what I want to make sure is that you can actually see my screen. So just give me one moment so we can make sure we don't have any technical errors. All right. So unfortunately, I'm going to have to, because of the technical issues, I'm going to have to actually be on my cell phone so that I can view your responses. So thank you for bearing with me. And I hope that everyone has had a wonderful day. Happy Wednesday. And we'll get started as soon as I pull up the chat on my phone. All right, and I got it. All right, so let us get started, everybody. All right, so question number one. This one should be super easy for you all. What is osteoporosis? Is it A, inflammation of the joints? B, a condition where bones become weak and brittle? C, a disorder where the immune system attacks muscles? D, a congenital deformity of the spine? Hey, everybody, I see you. I hope you can hear me okay. If you can hear me okay, give me a thumbs up. Let me know that you can hear me. Again, having technical issues, but I want to make sure we get this video done. Oh, I see so many correct responses. All right, so revealing the answer in 5, 4, 3, 2, and yes, osteoporosis. It is B, a condition where bones become weak and brittle. All right, thank you for giving me that thumbs up, Alicia. Osteoporosis is characterized by decreased bone density, making bones fragile and more prone to fractures. It often affects postmenopausal women and the elderly. All right, next question. Which patient is most at risk for developing osteoporosis? All right, so this is really important because patients with osteoporosis, they're prone to injuries. So is it going to be a 22-year-old male who exercises regularly, B, a 35-year-old pregnant woman, C, a 55-year-old postmenopausal woman, or D, a 40-year-old man with a sedentary lifestyle? What do you say, team? Looks like Pam says C, Alan Queen says C, Robin says C. So we're going to go with the C's. Let's see if the C's have it. And of course you do. A 55-year-old postmenopausal woman is a correct response because postmenopausal women are at higher risk due to decreased estrogen levels, which impact bone density. It puts them at an increased risk of falling, you all. So, this is easy. Everyone has this one. What is considered a normal blood pressure for an adult? Is it A, 80 over 50, B, 200 over 120, C, 160 over 100, or D, 120 over 80? Jerlene, Robin, is it Weshner? Joe, so many of you all, I can't keep up. I can't keep up, but I'm proud of you. You know that it is, that says the wrong response, but it is D, everybody. It is 120 over 80. All right, so which intervention is appropriate for a patient with rheumatoid arthritis? Oh, this one's tricky. Is it A, apply heat packs to chronically inflamed joints? B, apply cold packs to chronically inflamed joints? C, limit fluid intake? Or D, recommend high impact exercises? What do you think? Oh, rheumatoid arthritis. I see a lot of A's. I see a B. Oh, so we're torn between A's and B's. I know, I know. The best rule of thumb is to go by the plan of care, whatever the doctor has ordered. But the correct response is going to be A. Usually for chronic injuries, it's going to be apply, I shouldn't say chronic injuries, chronic conditions. We're going to apply heat to those inflamed joints. And the reason why is because heat can help relax muscles and reduce joint stiffness. Rest is also important, but activity should be balanced. When you think of ice, think of a new injury. We want to rest it, ice it, contain it, or compress it and elevate it. So usually ice is for something that's new, not chronic. Next question. Which of the following is a hallmark sign of gout? Is it A, pain in a large toe, B, muscle cramps, C, widespread joint pain, or D, bone deformities? And you all, we are staying for 100 questions. That means we're going to be here for 2 hours. So go ahead and get you something to drink, some water, preferably. And we're going to have a good time. All right. So we're revealing the answer in 3, 2, and I see a lot of correct responses. And yes, it is pain in the large toe. It is A. So gout commonly affects the big toe, causing severe pain, redness, and swelling due to uric acid crystal deposits. So you all, when you're putting on those socks, when you're doing anything with a patient's foot, don't grab their toes. You won't know they have gout until they're screaming. So make sure that you just don't grab them by their big toes. You want to use the larger joints, maybe lift the foot by the heel instead of grabbing their toes. All right, let's go to our next one, team. A patient with a fracture is placed in a cast. What is a sign of compartmental syndrome or compartment syndrome? Is it A, itching under the cast, B, decreased range of motion, C, warmth and redness around the cast, or D, numbness and increased pain in the limb? Compartment syndrome. Hi, Kelly. Good luck with your test on Friday. I think I've seen you for a few videos. You're going to do fine. You all, these questions, there is probably not a test question they can ask you that we haven't covered in our videos. So we rarely have our viewers or our students who fail. And yes, the questions that we have here are good for those nation and worldwide because it's based off of national standards. And most other countries utilize US standards for medical care. So you're going to do well. All right, everybody, revealing the answer in 3, 2, and yes, it is D. Give yourself applause. Numbness and increased pain in the limb. So compartment syndrome, the cast is too tight, or the cast was the right size, but because the leg kept swelling, now we're having circulation issues. So compartment syndrome occurs when pressure builds up within a muscle compartment, leading to pain, numbness, and decreased blood flow. Oh, nutrients. Which nutrient is most important for bone health? Is it vitamin C, iron, calcium, or potassium? And why should you care about this? Because you're going to be feeding people who got deficiencies. And you need to know what you're feeding them and why they need to eat such and such, because you all help reinforce what the nurses already taught. So everybody revealing the answer in 3, 2, and 1. Of course, it was C, calcium. All right, so calcium is essential for maintaining strong bones and preventing osteoporosis. Carmine, is it Carmel or Carmine? I like that emoji. All right, so let's see. Oh, everyone's going to get this one. What is scoliosis? Is it a herniation of the intervertebral disc? B, a narrowing of the spinal canal? C, a fracture of the spine? Or D, a condition where the spine curves sideways? So remember, you have to think holistically. When you're taking care of these patients, you're taking care of people who have conditions. So you have to know about the conditions. And I'll reveal the answer in 3, 2, and yes, it is D, a condition where the spine curves sideways. It's often diagnosed in childhood. So whenever you see an older person with scoliosis, they've had this deformity. They probably have pain. They have muscular issues. More than likely their hips are not aligned properly, so they're going to be limping off to one side because of the abnormal curvature of the spine. So when you see someone who has that issue, just give them a little bit of extra attention. Hey, do you need help getting up? Do you need your walker? Do you need your cane? All right, next question. Which patient care strategy is important for a patient with osteoporosis? Is it A, encourage high impact exercises, B, use fall prevention measures, C, limit calcium intake, or D, avoid weight bearing activities? Oh, I am so proud of you, Tawana. Congratulations. And the crowd goes wild. I'm so proud of you. Everyone give Tawana, celebrate her on her passing of her exam. That is so important. First step towards nursing, first step into PA school. The sky's the limit once you have your CNA license. So everybody revealing the answer right now. Yes, it is going to be B. Use fall prevention measures. So patients with osteoporosis are at high risk for fractures. Fall prevention strategies reduce those risks. All right, so what is a common complication of immobilities in patients with musculoskeletal disorders? So if they're not able to move it, they're going to lose it. So is it going to be A, pressure ulcers, B, increased appetite, C, improved muscle strength, or D, enhanced bone density? Yeah, that's why we get those Hoyer lifts. We get those patients up if they can't get up on their own without assistance. Why do we get these patients up? Why do we move them? Because, yes, team, it is A. We want to, of course, improve circulation, but also decrease those pressure sores. So immobility can lead to decreased circulation and increased pressure on the skin, thus resulting in the pressure sores, which is why if someone's bed bound, you turn them every 2 hours, but still you, the nursing team, physical therapy, someone should be trying to get a Hoyer lift or something to get them out of bed into a chair so they can change those pressure points. All right, so what causes gout? Let's see if you remember. Is it A, lack of vitamin D, B, decreased calcium absorption, C, autoimmune response, or D, excess uric acid in the blood? And I'm so proud of you all. Remember, we're going all the way to 100 questions. I see Pam, I see Sola, Maud, Lyrics, Chrissy, Reza, Ben, Rosalie, Theodore, Hopi. All right, everybody, you got it, you got it, you got it. It is D. Ow, that doesn't look good. It is excess uric acid in the blood. So gout is caused by the buildup of uric acid crystals in the joints, leading to inflammation and pain. They gotta stop eating the bad foods. They gotta stop eating. Sometimes they're eating too much liver, too much processed foods, and that's going to cause gout. Also, beer consumption. So if they're having gout flare-ups, it's usually it can sometimes be treated by modifying their diet, and if not, then they'll be put on medications to decrease the uric acid production. All right, so which of the following is a sign of a hip fracture in an elderly? Is it A, difficulty speaking? Well, that doesn't make any sense. B, fever and chills. C, shortened and externally rotated leg. Or D, redness and swelling in the joints. What is pericare? Pericare, perineal care is care to the genital area. So when they say perineal care, it's pretty much, if it's a female, it's the vagina, rectum, and buttocks. If it's the male, it's going to be the penis, the testicles, the rectum, and the buttocks. So anything that would be in the diaper region. All right, so everybody revealing the answer in 3, 2, and 1. The answer is C, shortened or externally and externally rotated leg. So hip fractures often cause the affected leg to appear shorter and rotated outward. What is the primary treatment goal for a patient with a herniated disc? Is it A, prevent bone deformity, B, relieve nerve compression, C, strengthen the immune system, or D, increase blood calcium levels? You're taking care of patients with chronic illnesses and conditions. So if a person comes in with a herniated disc, what do you think the goal should be? Yes, everybody, the goal should be B, because that herniation, it could be pressing on a nerve. That's when they're like, oh, I have leg pain. The sciatic nerve is being affected. So remember, nerves run all up and down from the brain to the toes. So if there is pressure, if there is something that is pinching a nerve, your patient is going to have pain, tingling, numbness, etc. So a herniated disc can press on spinal nerves, causing pain and discomfort. The goal is to relieve this pressure. Which musculoskeletal condition is characterized by widespread musculoskeletal pain and fatigue? This may be a new one for you all. Is it going to be A, osteoporosis, B, rheumatoid arthritis, C, fibromyalgia, or D, scoliosis? This one's tricky. Introducing new medical terms to you. I'll reveal the answer in 3, 2, and Hopi has it. All right, everybody. It is, hold up, it is C. Did anyone chose C? It wasn't Hopi, it was Karen. All right, so Karen, it is fibromyalgia. You all, there are a lot of patients with fibromyalgia. It is pain from head to toe. So fibromyalgia involves chronic, widespread pain and often coexists with fatigue, sleep disturbances, and memory issues. So remember that medical term. Which intervention is appropriate for a patient with fibromyalgia? Is it A, high intensity exercise, B, avoid physical activity, C, decrease fluid intake, or D, balanced diet and low impact exercise? Well, this one's so easy. If someone's in pain, we're not going to do anything high intensity. Of course, if they don't use it, they're going to lose it. So we're not going to tell them to avoid activity. So process of elimination, it must be D, balanced diet and low impact exercise. All right, let's keep it going. What is the term for inflammation of the bursa? What in the heck am I talking about? What is a bursa? So is it A, osteoarthritis, B, bursitis, C, bursitis, or D, synovitis? What is the term for inflammation of the bursa? And everyone should get this right. Yes, everyone got it right because I just made B up. B is not a real word. So it is bursitis. Bursitis is the correct term for the inflammation of the bursa, which are small fluid-filled sacs that cushion the bones, the tendons, and muscles near joints. Bursitis often results from repetitive motion injury or overuse. So sometimes people who play tennis, they may complain of having bursitis. Osteoarthritis is inflammation of the joints. Bursitis is something that Nurse Eunice just made up. It doesn't exist. And then the synovitis, refers to the inflammation of the synovial membrane. What is a priority in caring for a patient with a cast? Is it A, use a hair dryer to dry the cast quickly? B, keep the cast covered with plastic at all times? C, monitor for circulation issues in the extremities? Or D, apply lotion to the skin under the cast? What is a priority? All right, Kabasha, we'll be praying for you. Your test is right around the corner. Everybody who chose C, I'm going to pause and give you applause. Yay! Great job. We're going to monitor for circulation issues. We need to check those pulses. So monitoring circulation ensures there is no compromise to blood flow, which can cause complications. Remember that compartmental syndrome or compartment syndrome where the extremity begins to swell, and it's going to cause that decreased blood flow. So if a person is having tingling, numbness, color changes, if the pulse is weaker, you need to be notifying your nurse right away. Next one, which condition is caused by repetitive motion and affects the wrist? Is it going to be A, carpal tunnel syndrome, B, gout, C, bursitis, or D, scoliosis? Since this is so easy, I'm going to reveal the answer in 3 seconds. Let's see how many correct responses do we have. Pam is on it, and I don't want to mispronounce your names. So I'm going to call you Kirk and Robin And oh, Tashaka, I hope I said that correctly. Good luck on your test in the morning. Yes, everybody, it is a woohoo, carpal tunnel syndrome. Results from compression of the medial nerve in the wrist due to repetitive motion. If you're having those issues, remember there are certain pads that you can buy from any big box store, so that whenever you are typing, your wrist will have cushion. What is the key feature of Paget's disease of the bone? We don't see this often in the United States. So, what is Paget's disease? Does it cause A, decreased bone mass? A, decreased bone mass, B, disorganized bone remodeling, C, joint deformity, or D, excessive calcium? We are so fortunate, but if you ever travel about, if you do missionary work, you go to other countries, you're going to see that Paget's disease is B. Great job, team. Disorganized bone remodeling. So Paget's disease involves abnormal bone remodeling, leading to weak, enlarged, or misshaping bones, as illustrated in the image. All right, so what is the most common cause of lower limb amputations? Is it trauma, infection, peripheral vascular disease, or PVD, or bone cancer? I'm making sure that you all know all of these conditions that these patients come in with, so that you kind of understand what you have to do to prevent the amputation. All right, so let's see. And I see a mix. I see a lot of B's. I see C's. I see A's. I see a D. All right, you all gave me the full alphabet. The most common cause of an amputation is poor circulation. It is C, peripheral vascular disease. So PVD, often related to diabetes and poor circulation, is a leading cause of lower limb amputations due to tissue death. And yes, trauma, injuries, infections can cause the need for an amputation also, but the most common reason is because they lost circulation or blood flow to that area. So the correct response is going to be C. What is a priority nursing intervention for a patient post-amputation? Is it A, elevate the stump for 24 to 48 hours? B, avoid range of motion exercises? C, keep the stump covered at all times? D, encourage lying in a supine position continuously? Mila, you are on it. Mila, was that from the previous one, or is it from this current one? Let's see. Ooh, you all slowed with your answers. So Mila says A, Karen says A, Theodora says A, Chrissy says A, Kelly, Yasmin. So yes, everybody, priority after an amputation is going to be A. We're only going to elevate it for a few days, so we're not going to keep it elevated indefinitely. But we're going to elevate the stump for 1 to 2 days, 24 to 48 hours, because of the swelling. So elevating the stump during the first 24 to 48 hours post amputation helps to reduce swelling and promote venous return. That means the blood just isn't sitting there stagnant. It's returning to the body, which is crucial in the immediate post-operative period. However, prolonged elevation beyond this period is avoided to prevent hip contractures. It'll get stuck, especially in lower extremity amputations. So great job, winners. Which sign suggests the presence of osteomyelitis? Is it A, joint stiffness and swelling? B, localized bone pain, redness, and fever? C, muscle weakness and cramps? D, tingling and numbness in the extremities? Osteomyelitis. Break those words up. What is the term that we're referring to? Osteo, prefix, itis, suffix. What are we talking about? We're talking about inflammation in the bone. Okay, so localized bone pain, redness, and fever. Of course, if there's inflammation, more than likely it's due to infection. So, osteomyelitis is a bone infection, and its symptoms include pain, redness, swelling, and systemic signs such as fever. And for you all who are enjoying this exam, if you haven't done so, give us a thumbs up. Remember, we are going to be here for 2 hours, so we have over an hour of questions left. And also, something else I want to add is if you are understanding the questions more when they are read to you. Whenever you take your CNA examination, even though it's multiple choice on the computer, you can ask for an audio test. You can ask for an earpiece that only you can use, where you can hear the questions read to you and also the answers. So just keep that in mind, because that's going to help you pass this test. And my goal is for you to pass the test. Use whatever tools they have available for you. Right. So now that we know what osteomyelitis is, what is the primary treatment? Is it A, surgery to remove the affected bone, B, amputation, C, immobilization of the joint, or D, long-term antibiotic therapy? Priority treatment. And for this one, I'll take two answers because it depends on the patient's condition. So, what do you think the correct response is going to be? I see a lot of C's, D's. Panaya says, is this a CNA or a nursing question? Because you're working with nurses, it is both. It's CNA and it's nursing, because you need to know what these conditions that your patients have. You're just not reading a chart. A patient comes in with osteomyelitis and you have 14 patients, and you're not really caring this person has an infection that goes down in their bone that can lead to infection. You don't have to be a nurse to be a good caregiver. So my questions are for CNAs who are becoming nurses. I hope that helps answer your questions, Panaya. All right, so here we go, everybody. Revealing the answer in 3, 2, and 1. All right, it is D, long-term antibiotic therapy. So osteomyelitis is treated primarily with antibiotics to target the infection. And of course, if the antibiotics do not work, that is when they will consider amputation. And so if you feel that these questions are beyond your level of comprehension or level of knowledge, there are some other nurses on YouTube that will have questions that are easier. But my questions are for CNAs who are going to be nurses. Ha ha ha. All right, so let's keep going, everybody. What is a common early symptom of bone cancer? Is it A, sudden weight gain, B, persistent and localized bone pain, C, muscle twitching, or D, joint stiffness? Common and early symptom of bone cancer. You are taking care of somebody on an oncology unit. What would be a symptom of bone cancer? And if you chose B, you got it. That is right. So bone cancer often presents as localized pain that worsens over time and may not improve with rest. What is the most common type of primary bone cancer? This is hard. So I'm just going to give you the answer. So is it A, osteosarcoma, B, Ewing sarcoma, C, multiple myeloma, or D, chondrosarcoma? And so I know you all, those are some big terms. And at the end of the day, that is for a doctor to diagnose. But the most common type of bone cancer is going to be the osteosarcoma, and it usually affects the lung bones in children and young adults. So if you're working in a pediatric hospital, that could be a definition. See, that can be a diagnosis that you might see in a chart. All right, here's our next one, everybody. Which intervention is most appropriate for a patient undergoing chemotherapy for bone cancer? Is it A, encourage a high protein diet to support healing? B, restrict fluid intake to reduce swelling? C, avoid frequent repositioning? Or D, promote weight-bearing exercises? Patient is on chemotherapy. What do you know about patients who receive chemo? Do they eat well? Do they eat well? Are they nauseous? Do they vomit? Do they have diarrhea? So what am I getting at? They have poor nutrition, you all. So I need you to do A. Great job, everybody. You're going to encourage a high protein diet to support healing. And because they may not want to eat it because they have a poor appetite, they may have to use some type of supplement. So, of course, there are natural supplements or organic supplements They may not want to eat meat. So whey and some other protein powders or the boost shakes that they have in the facilities may be a good option, but always check with your nurse before you give that to the patient. All right, so phantom limb pain occurs due to what? Is it A, poor circulation, B, immune system response, C, damage to the nerve pathways, or D, infection at the surgical site? Phantom limb pain. This is terrible to witness. What is phantom limb pain? I see so many correct responses. You should be so proud of yourself. It is C, damage to the nerve pathways. Let me go back, make sure that was it. Yes. All right, so it is damage to the nerve pathways. So after an amputation, patients still feel as if their limb is still there, because the body remembers there being a foot there. So this person's going to be complaining about foot pain, but the foot has been amputated. So phantom limb pain arises from nerve damage and misinterpretation of signals in the brain. It can persist after an amputation. All right, so what is a key nursing consideration for a patient with osteosarcoma? Remember, this is the bone cancer that is usually diagnosed in youth. Is it A, monitor for signs of hypercalcemia? Is it B, encourage frequent bed rest? C, apply cold compresses to the affected site? Or D, limit intake of dairy products? So I'm going to go ahead and give you this answer because this one could be a little tricky. But when someone has a bone disorder, the calcium from the bone could leak into the surrounding tissues and get into the bloodstream. So the answer is going to be A. So hypercalcemia. Hyper means too much. Calcemia refers to calcium in the bloodstream. Why is that important? What are you monitoring for? Neurologic confusion. Your patient becomes confused. Usually as medical professionals, we know if someone becomes confused, something is out of whack. Something is not in balance. Are they dehydrated? Do they have a UTI? What do their labs look like? So that's why the nurses are always getting those labs. All right, so too much calcium can cause cardiac arrhythmias, which means your patient's heart could stop. They can go into cardiac arrest. It can cause kidney damage. They can start being nauseated and vomiting, so gastrointestinal issues. So that's why a good CNA, whenever they notice something that isn't right, they go ahead and notify the nurse and tell the nurse, so the nurse can get in there and do those extra tasks, such as calling a doctor, getting blood samples, getting the EKG, etc. All right, so which population is most likely affected by Ewing sarcoma? Is it going to be elderly adults, adolescents, and young adults, C, middle-aged women, or D, infants? Yes, we're talking about bone disorders today. We're talking about vitamin deficiencies. We're talking about all the stuff that you really need to know when you're in the hospital with 16 patients and everybody's vomiting. Things are going to be out of balance, and a good CNA is going to help catch some of this stuff. So here we go. It is going to be B, adolescents and young adults. So Ewing sarcoma typically affects adolescents and young adults and often involves the pelvis or long bones. All right, so we're back to the prosthetic limbs, the amputations. What is an essential care step for a patient with a prosthetic limb? Is it going to be A, inspect the stump for signs of irritation or breakdown? B, avoid cleaning the prostheses daily? C, encourage wearing the prostheses 24 hours a day? Or D, limit physical therapy sessions? All right, it's bath time. You're about to give someone a bath and they had an amputation a week ago. There's no dressing on the site anymore. They have their sutures. What are you concerned about? And if you chose I see you all, yes, it is A. You're going to, just like you inspect the rest of that skin, you're going to inspect the stump. Yes, the nurse was supposed to look, but hey, you're in there giving a bath. I need you to look too. So the rationale, regular inspection ensures early identification of skin issues, improving comfort, and preventing infections. And next one, everybody, what type of fracture is most commonly associated with osteoporosis? All right, so Mrs. Beverly, she's your patient in the hospital. She is 80 years old and she has a diagnosis of osteoporosis. What is she most likely to what other conditions is she most likely to have? Is it going to be A, an open fracture, B, a spiral fracture, C, a compression fracture, or D, a green stick fracture? And I'm just going to give you the answer because all you know is it's a fracture and something's broken, and I am totally okay with that as long as you tell me when a patient's in pain. And so the answer is going to be a compression fracture. It's going to be C. Compression fractures, especially in the spine, are common in individuals with osteoporosis due to weakened bone structure. All right, so we're back to Paget's disease. I hope you remember from the previous slide. So Paget's disease increases the risk of, is it A, bone infections, B, malignant bone tumors, C, muscle tears, or D, rheumatoid arthritis? As a CNA, you can work anywhere that a nurse works. So you can work in the children's hospital, you can work in the jails, you can work in nursing homes, you can work in educational facilities, you can also work in hospitals, you can work in home care too, if I didn't mention home care. So you don't know what type of condition or the patient's condition that you're going to run into, but a person who has Paget's disease is B. They are at risk of having bone tumors. And so that would be something, again, that you'll see if you're working in the pediatric population. Our next question: which condition results in the death of bone tissue due to lack of blood supply? Terminology: which condition results in the death of bone tissue due to lack of blood supply? Is it osteomyelitis, or B, avascular necrosis, C, osteoarthritis, D, fibromyalgia? What is it called when the tissue dies? What is the term that we use? If you understand the name of the term that refers to tissue death, you're going to get this answer correct. And everybody, I'm revealing the response in 3, 2, and it would be B, avascular necrosis. Necrosis means tissue death. It occurs when the blood supply to a bone is cut off, is disrupted, and the bone tissue dies. Our next question, team: what is the best intervention for preventing falls in a patient with a musculoskeletal disorder? So we've talked about disorders, but how does it impact you as a CNA? How do you reduce those falls? Is it A, reduce fluid intake to avoid nighttime walking? B, encourage walking barefoot for stability? C, minimize the use of assistive devices? Or D, keep the room well lit and free of clutter? And we'll reveal the correct response in 3, 2, and you got it, team. Awesomeness. It is D. They usually in your rooms have little night lights that could be motion activated. So as soon as the feet hit the floor, a night light comes on so that your patient's not walking in the room in the dark. But that helps to ensure a safe environment, which is crucial in preventing falls, especially in patients with musculoskeletal conditions. Ooh, what is cellulitis, team? A patient came in with a diagnosis of cellulitis. What are you expecting to see? Is it A, a viral infection causing blisters? B, a bacterial infection of the skin and soft tissues? C, an allergic reaction to irritants? Or D, a chronic autoimmune condition? Cellulitis. All right, I know you know the answer, and I'm revealing the response in 3, 2, and yes. Ooh, that looks painful. It is a bacterial infection of the skin and soft tissues. So cellulitis is caused by bacteria, typically Staphylococcus, resulting in redness, swelling, and pain. And sometimes it can ooze or drip too. So yeah, really, really bad condition. Which symptom is commonly associated with eczema? Is it going to be A, pus-filled blisters, B, circular rash with a red center, C, painful crusted sores, or D, scaly, itchy patches of skin? So again, this video tonight is focused on conditions. You all have to learn some of these conditions. Because if you learn a condition when they're throwing terminology during your CNA test and they mention cellulitis, if they mention osteoporosis, you'll be better able to answer those questions. So everybody, I'm revealing the answer in 3, 2, and yes, it is D, scaly patches of skin. So eczema or atopic dermatitis presents with dry, itchy, and inflamed skin patches. Okay, so what is the primary cause of shingles? Ooh, painful condition. Is it A, reactivation of the chickenpox virus? B, direct contact with bacteria? C, prolonged sun exposure? Or D, a fungal infection? What is shingles? And do you want it? And of course, that answer is going to be no, you don't want it. All right, so shingles is caused by A. It is the reactivation of the chickenpox virus. You all look at that image. They're usually clusters of blisters. So shingles is caused by the varicella zoster virus, which remains dormant in the body after chickenpox and can reactivate later. It is painful and it is contagious. Which patient is at the highest risk of developing shingles, you guys and gals? Is it going to be A 10-year-old child who received the chickenpox vaccine? B, a 25-year-old with no history of chickenpox? C, a 65-year-old with a history of chickenpox? Or D, a 40-year-old with a fungal skin infection? Oh. So for this one, you all, which is why it's so important with the elderly population, shingles is usually because it lies dormant. It affects those who are elderly. So the response is C, a 65-year-old who had a history of chickenpox. Remember, it was reactivated. It's just been there dormant for years. And now, as an older adult, it can cause some severe skin conditions and some other conditions that we'll talk about in a few moments. All right, so yeah, you're on the floor today. You're on the med surge floor. We got amputations, we got chicken pox, we got broken bones. So what precautions should be used when caring for a patient with MRSA skin infection? So that's methicillin resistant Staphylococcus aureus, MRSA for short. Okay, so what are some precautions? Would it be a droplet precaution, airborne precaution, contact precaution, or standard precautions only? Everyone got the correct answer. All right. I am so proud of you. Yeah, standard precautions just means wash your hands, use hand sanitizer. We are going to do more than standard precautions. We are going to do C. That patient needs to be put on contact isolation because MRSA is transmitted through direct contact with infected wounds or contaminated surfaces. Thus, it requires gown, gloves, and hand hygiene. Going back to cellulitis because today you're in Nurse Eunice's med surge unit and you have a lot of patients. So what is a common symptom of cellulitis? Is it A, painless lumps, B, red, warm, swollen skin, C, thick yellow crust on the skin, or D, fluid-filled blisters? And this one's easy because you already saw the image, so you know that it is going to be B. Great job. What is the appropriate treatment for shingles? All right, so we have a 65-year-old patient. They're on the unit. They have the red blisters. She didn't even know what it was. You recognize them during the bath. You notify the nurse. You put her on isolation. What do you think the treatment is going to be? Is it A, antifungal cream, B, antibiotic ointment, C, antiviral medication, or D, corticosteroids? Even though you don't give the medication, it just makes sense that you know what's happening. All right, so I'm going to reveal the answer in 3, 2, and I see so many correct responses. Remember, herpes simplex is a viral. So I'm sorry, I said herpes. Chickenpox is a virus. So here we go. It is going to be C. All right, you're going to the nurse is going to actually give them an antiviral medication, such as a cyclovir, because it reduces the severity and the duration of the shingles. Our next one, everybody. This one's easy. What skin condition is characterized by a group of painful skin blisters? And because we already know this answer, I'm just going to go straight to it. Of course, that's going to be shingles. Next one, how is chickenpox transmitted? Chickenpox. When you're young, it's called chickenpox. When you're old, it's shingles. So how is it transmitted though? Is it A, direct contact only? B, airborne droplets and contact with lesions? Is it C, contaminated water? Or is it D, insect bites? This is important. You have to know, because if that patient has those little blisters on their butt, more than likely they have shingles, and we're going to put them on isolation. But what type of isolation? Is it only contact? Oh, I am so proud of you. It is so many of you all who know the answer. Longa, Marjorie. And I'm looking at my phone, but I am so proud of you for knowing that, yes, it can be transmitted in the air, you all. So it's going to be airborne droplets. So airborne precautions. So airborne, and of course, you're going to have your mask, your gown, and your gloves. And the rationale is chickenpox spreads through the respiratory droplets or direct contact with the rash. And again, it's contagious and you don't want to contract that or take it home to your family members. All right, so what is a hallmark symptom of an MRSA infection? Is it A, red swollen bump that may drain pus? B, a scaly rash with white patches? C, a painful itchy blister? Or D, a circular red rash with a central clearing? The fact that I don't even know what D means. So it is not D. Yes, everybody. I'm so proud of you. And that looks horrible. That looks very bad. That doesn't look good at all. So A red swollen bump that may drain pus. So MRSA often presents as that painful pus-filled lesion or abscess on the skin. And sometimes someone say, hey, I got bit by something. And by the time they come to the hospital a week later, it's too late for them to receive oral antibiotics. They're going to end up receiving IV antibiotics. So thus, they're going to need wound care and long-term antibiotic use. When I say long-term, in the hospital, they may only be there for a week on antibiotics, but when they're released, they're more than likely going to be released on a pill form of antibiotics. So if you notice something that doesn't look right on yourself or others, please report it as soon as possible, because the sooner that you report it, we can use less invasive treatment such as pills, and they won't need intravenous antibiotics. Okay, next one. What is the most important step in preventing the spread of MRSA? Is it A, wearing a mask? B, frequent and thorough hand washing? C, limiting visits to the patient? Or D, disinfecting with alcohol? How do we prevent the spread of this superbug? How do we prevent our cancer patient from contracting MRSA? Your patient in room A has cancer and is on chemotherapy. Your patient in room B has a wound infection and has MRSA. I need to make sure that my caregivers, my future nurses, my current CNAs are doing B, frequent and thorough hand washing to help prevent the spread of that germ throughout the unit. All right, our next one, team. Which skin disease is often triggered by allergens or irritants? A skin disease that's triggered by allergens. Would that be cellulitis, MRSA, shingles, or eczema? It is D, eczema. When you think about eczema, think about someone's skin that has something similar to asthma. So if the skin gets pollen, if it gets too much chemical, too much irritants, it is going to become itchy and scaly. So eczema is pretty much the asthma of the skin, and flare-ups can be quite devastating to a person. They would have to go to a dermatologist if they don't have a doctor who can treat their eczema flare-up. All right, so which mouth condition is caused by a viral infection? And my fingers are crossed, everyone's going to get this right. Is it gingivitis, oral thrush, cold sores, or gum disease? Which condition is caused by a viral infection? Revealing the answer in 5, 4, 3, 2. Yes, you are correct. It is C, cold sores. So cold sores are caused by herpes simplex virus, or HSV1. And so they are also contagious. And so you can actually be a carrier before you have your breakout. So if you feel something, especially as a caregiver, be very careful touching your face, touching your phone after you've cared for these patients, because the patient may not have an active lesion on their mouth. But we know with stress and being in that hospital, they may feel their lip tingling and you're just in there touching everything and not washing your hands. And then, of course, you touch your phone or you touch your lip, and now you have the cold sores, aka herpes simplex. So please wash your hands and be very mindful about touching your face and your phone while you're at work. All right, so what is the recommended PPE for dressing a wound infected with MRSA? And I know you're like, I'm not going to be doing wound care. I am not a nurse. Well, guess who's right in there with the nurse? Guess who gets the supplies? You do. So you have to know this. What is the PPE? Is it going to be A, gloves and mask only? B, no PPE is required? C, glove, gown, and mask? Or D, gloves and gown only? And we don't want to overdo it. Now, I know we can just be in there head to toe and put a whole bunch of garments on and be like, I'm protecting myself from getting MRSA, but you don't want the patient to feel uncomfortable. So we use the least amount of personal protective equipment or PPE possible. And if all you and your nurse are doing is changing a wound, or you're helping with holding a patient while the nurse changes the wound, what you need to have on is D. Great job. It is gloves and gown, because it protects against the direct contact with the affected wound and the contaminated surfaces, the side rails, the sheets, all the other stuff that you're going to be touching while you're holding that patient as the nurse changes the dressing. All right, so what is a common complication of chickenpox? Is it pneumonia, cold sores, bone infections, or muscle spasms? This one's hard. This one is hard. Now, we talked about it being airborne. So that's the hint. So what would be a complication? Revealing the answer in 3, 2, and looks like I have a V Rose. Looks like she has it or he has it. It is going to be pneumonia. I know, isn't that odd, right? How can a skin infection cause pneumonia? But chickenpox can lead to complications like pneumonia, especially in immunocompromised patients. Who would be immunocompromised? Someone receiving chemotherapy, someone with late-stage HIV. So chickenpox can lead to pneumonia when the varicella zoster virus spreads to the lungs. Remember, these germs move. They're touching their mouth, they're coughing, they're doing all types of things. And so if those germs enter their airway, it can cause pneumonia. All right, so our next one, team. There we go. What is the best prevention strategy for shingles? And everyone knows this one. We're going to do I was going to say B. But it's not B, it's C. That patient, hopefully they'll receive a vaccine. There is a vaccine for shingles. And if you are vaccine hesitant or your patient's vaccine hesitant, remember that's not a conversation that you as a CNA would be having with a patient. That is a conversation the nurse and or the doctor would be having. But shingles, there is a vaccine that treats it. And I'm sorry, if I'm in the hospital and I have all these blisters and I'm in pain, more likely I'm just going to say, give me the vaccine if it's going to prevent the reoccurrence of the shingle virus from coming again. All right, and so you all, we are halfway done. We are now on question 50. And so if you haven't already done so, go ahead and like the video, hit the subscribe button, and we're going to continue right now. Which condition results from a fungal infection? Is it eczema, athlete's foot, shingles, or cellulitis? A fungal infection. So when you're in the hospital, you have all those ointments, butt paste, creams, and we're like, hey, don't just be putting that stuff anywhere, because not all infections are caused by bacteria. Not all are caused by moisture. So you don't want to be putting butt paste on someone's foot because if you do, you would give a place for the fungus to grow. They need wet, dark places. So a fungal infection could be the cause of athlete's foot, and your nurse will contact the doctor and get a special powder or a special ointment that goes on their foot. So athlete's foot is caused by a fungal infection leading to itching, cracking, and redness between the toes. So just because you have access to some medications, or some ointments, please don't just start randomly putting them in places. Let your nurse know if there's a new infection. Which symptom is typical of oral thrush? All right, so is it going to be white patches on the tongue or inner cheeks, painful blisters around the mouth, cracked corners of the lips, or red swollen gums? Oral thrush. What is thrush? All right, I'm going to show you a picture of it in a few moments. All right, everybody, here is the response with the photo. That is thrush, that white crusty stuff on the tongue, the patches. So the answer is A, white patches on the tongue or inner cheeks. Oral thrush caused by candida or yeast presents with that white patch in the mouth. And so that usually happens because of antibiotic use, or because maybe when they take their nebulizer treatments, they don't rinse their mouth afterwards. So if you see something like this, you can use all the mouthwash, you can brush your teeth all day long. And because this is a fungus and not a bacteria, it's candida, it's yeast, and it's not a bacteria, you need to let your nurse be made aware so she can order the appropriate mouthwash that's going to kill yeast in addition to the other germs that are on the tongue. All right, so what should a CNA do if a patient with cellulitis has a fever? Do you want to encourage exercise? Document the temperature and recheck in 8 hours? Report it to the nurse immediately? Or increase oral fluid intake? What is the safest for that patient? They have a fever. What do you want to do? Hoo-hoo! I'm so proud of you. Yes, you are going to report it immediately. It's going to be C, because that fever can indicate worsening infection. And so when we say worsening infection, remember, when it leaves the skin, it can go into blood. It can cause sepsis. It can go into the bone and cause a bone infection. So if that person has a fever, notify the nurse right away. All right, so what is a key intervention for preventing eczema flare-ups? So today you're taking care of 55-year-old Mr. Jenkins, African-American male. He has eczema. You are given the bath. Do you want to do A, apply perfume-containing lotions? B, keep the skin moisturized? C, use hot water for bathing? Or D, avoid all topical medications? And we know a CNA doesn't give medication. So what do you want to do as the CNA caring for him? And he has eczema. Yes, 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 y'all. We got to use some lotion. We got to use some lotion. It's going to be B. We're going to keep the skin moisturized. So, moisturizing prevents dryness and irritation, which are common triggers for eczema. And we can use hypoallergenic lotions so they won't have a strong smell. And sometimes, like oatmeal based type lotions will help soothe the skin. When in doubt, contact the nurse. And whoever gave me those hearts, I appreciate you. That made me feel so good. All right. So, which medication is commonly used to treat oral thrush? Remember, we said thrush was caused by what? So, is it going to be an antifungal mouthwash, an antiviral ointment, antibiotic pills, or corticosteroid cream? Oral thrush. Are we just going to go and give them the Listerine out of the cabinet that we normally give every patient? Or are we going to do revealing the answer in 3, 2, and yes, that nurse has to order a special antifungal mouthwash because oral thrush is treated with antifungal medications such as nystatin, or they have a swish and swallow, a swish and spit. So the person will just gargle, spit it out, and then rinse out their mouth. And usually in about a day, you all, their symptoms are improved because we have great caregivers like you who let us know when something's wrong. Right. Ah, what is the primary cause of canker sores? Is it a fungal infection, a bacterial infection, unknown or non infectious triggers, or a viral infection? I'm watching the chat. Let's see what answers you have. Canker sores. Let's see. I know this one's tricky, you all. What do you think? Revealing the answer in 3, 2, and looks like Vera has it. Vera and Pam, great job. And that one's wrong. It's not unknown. It's going to be D was viral infection, so it's not unknown. Canker sores are often caused by stress injury and acidic foods, and they are actually, I guess I have that one right, and it's not contagious. So I was thinking that it was viral infections, but they're saying that canker sores are not caused necessarily by infections for this one, but a cold sore would be. In some places, they use the term interchangeably. So I'm going to allow one of two answers for this one because I don't like this question. I don't like how it's worded. So I do apologize because as a CNA, if you see a sore on someone's mouth, you're not there saying, hey, it's a canker sore, it's a cold sore. You're like, hey, this doesn't look right. Let me tell my nurse. Let me tell the nurse who's going to tell the doctor. So for this one, I will choose either answer that you have selected. And I do apologize again. I don't like that question. All right. So our next one is, what is the priority nursing intervention for a shingles patient? Do you want to encourage scratching to relieve itching? Do you want to cover the rash with a moist dressing? Of course, we're talking from the nursing priority. You have to know what the nursing priority is. Remember, you're reading the whole care plan. So you all have what the nursing goals are, what the CNA goals are. So even though you are not in the role of the nurse, what would be the nursing goal? Would it be C, to administer pain relief and antiviral medications? Or is it D, avoid washing the affected area? And so if a patient has shingles, the nursing goal would consist of pain relief and symptom relief. So it's going to be C, pain medications and antiviral medications. All right, so a characteristic feature of a cold sore. Is it a painful ulcer inside the mouth? Is it a red fluid-filled blister on the lip? Is it white patches on the tongue? Or is it flaky, itchy skin? So is a cold sore inside the mouth or is it on the lip? What do you think, team? Revealing the answers in 5, 4, 3, 2, and yes, it is on the lip. Okay, so those painful blisters, which you've already covered in detail. All right, so what type of wound drainage is clear or slightly yellow and watery? Is it purulent, serosanguinous, sanguinous, or serous? Yes, you have to know what this means because when you are documenting drainage, you just can't be like, "Oh, yeah, it's yellow, it's white." If your facility lets you get away with that, it's fine. But it'll be awesome if you knew what those words actually meant. So, what does it mean when drainage is clear or slightly yellow? Oh, I see so many right answers. All right, revealing the answer in three, two, and it's Sarah's. It is D. So give yourself applause. So Sarah's drainage is clear or slightly yellow and watering, indicating normal healing. Other types of drainage may indicate blood. So when you see sanguineous, that usually means that it has blood. A mix of blood and pus, okay, would be serosanguinous. If it's just straight yellow, purulent, thick, that would be a sign of infection. So, and then of course, it may have a smell to it also. So, those are the medical terms for the colors of the drainage. It's going to be serous, sanguinous, serosanguinous, or it's going to be purulent. This one, I hope everyone gets it because your patients are diagnosed with this often. What is gastroesophageal reflux disease? What is GERD? Is it inflammation of the stomach lining? Is it a viral infection of the gastrointestinal tract? Is it a backflow of stomach acid into the esophagus? Or is it a blockage in the intestines? When we tell you that your patient has GERD, what does that mean? I'm doing my nursing dance because everybody has it right. It is C team. Oh, it's backing up, which is why we don't let you lay these patients down immediately after they eat because GERD occurs when the stomach acids go the wrong way. They back into the esophagus, causing symptoms like heartburn and regurgitation. And there are medicines that the patients can take, but a good CNA after the person eats, you allow them to remain in maybe like a reclining position, a semi-Fowler's position for about 30 minutes after they eat to make sure their food has time to digest. Which symptom is commonly associated with peptic ulcer disease? Is it A, sudden weight gain, B, burning pain in the upper abdomen, C, difficulty swallowing, or D, frequent diarrhea? To reiterate, you're caring for patients who have chronic diseases and disorders. You need to know what this stuff means. So if someone has peptic ulcer disease, yes, they have burning pain in the upper abdomen is B. And so peptic ulcers are sores in the stomach lining or intestines, often causing burning pain, especially when the stomach is empty. So that's why sometimes we have patients on a bland diet. We may put them on a liquid diet because if we give them solid food or something that's spicy and they have peptic ulcers, well, we know what's going to happen. The condition is going to be worse. The patient's going to be in more pain, and that could prolong their hospitalization. Which infection is most commonly associated with peptic ulcers? This one I'm just going to give you the answer because I know this may be a little bit tricky. So is it A, E. coli, B, Clostridium difficile, is it C, Salmonella, or is it D, Helicobacter pylori? We call it H. pylori for short. So whenever that person goes down and they go to the endoscopy lab, because if you're having stomach issues, the gastroenterologist is going to order an endoscopy and they're going to get some samples from the stomach lining and they're going to see if there is a infection present, and more than likely the most common infection is H. pylori. So it's an infection that causes peptic ulcers by damaging the stomach lining. If you got that one right, just cheers to you. I'm very proud of you. All right, so our next one. What condition is characterized by inflammation of the appendix? I'm always throwing in some medical terminology because when you take your test, they're going to have medical terms and you have to know what those terms mean. So if the appendix is inflamed by process of elimination, that must mean that the correct response is, look, you all are ready for your test. It is B, appendicitis. So appendicitis occurs when the appendix becomes inflamed, often requiring surgical removal. I hope you are as proud of yourself as I am of you, because you all are giving out so many correct answers from around the globe. I just know that you're going to make awesome caregivers, and I'm happy that you are here with me and I'm helping you along this journey. All right, you all, we have about 30 questions left. I'm so proud of you for doing this on a Wednesday night. So, what is the primary cause of hepatitis A? Is it contaminated food or water, bloodborne transmission, unprotected sexual contact, or autoimmune response? And notice it didn't say the cause is, it said the primary cause. What is the primary cause of hepatitis A? Let me look in the chat and see what your responses are. Catherine, Lily, Emmanuel. Let's see, the Chrissy, Pam. Do we have any more responses? Looks like we have Westner, Auguste, Gorlan. So everybody, the primary cause of hepatitis A. Think about the the viruses on the cruise ships when someone doesn't wash their hands and everybody's getting sick. And so it's going to be that contaminated food, or when you go to a different country, sometimes their water may be contaminated. So hepatitis A is transmitted through ingestion of contaminated water or food, typically in areas with poor sanitation. For those of you who are thinking about sexual activity, that's Hep C. Okay. Going to the next one. Which gastrointestinal condition is characterized by the inflammation of the colon and the rectum? So these are all common diagnoses that your patients could have. Is it going to be ulcerative colitis, Crohn's disease, irritable bowel syndrome or IBS, or diverticulitis? What GI condition is characterized by inflammation of the colon and rectum? Revealing the answer in 3, 2, and yes. Colitis, ulcerative colitis. Yes, it causes chronic inflammation and ulcers in the colon and rectum, leading to abdominal pain and diarrhea. So pretty much when a patient comes in with either of those diagnoses that were listed, they're going to be on a bland diet. And on top of that, they're probably going to have urgency. They're going to have to get to the bathroom fast because they may have bouts of diarrhea. Which intervention is important for a patient with GERD? What did GERD stand for? Do you remember it? Is it A, encouraging lying down after meals? B, promote a low fiber diet? C, elevate the head of the bed? Or D, advise heavy meals at night? If you do D, you're just not a nice person. Hey, ma'am, I know you have GERD. Let's go ahead and eat steak and potatoes before you go to sleep. So yes, we know that to prevent those acids from going the wrong way, we're going to elevate the head of the bed. It's going to be C during the mealtime. So let's keep the head of the bed elevated. So elevate the head of the bed reduces the nighttime reflux symptoms in GERD patients. And so what you'll oftentimes see is that these patients won't lay flat. So even when it's non-meal time, when they're just watching TV, they won't lay flat. You'll use maybe 2 or 3 pillows if the bed doesn't elevate. If the bed does elevate, keep them comfortable in a semi-Fowler's position, but they usually will not lay flat because they know that that acid is going to back right up. All right, so what is a common symptom of irritable bowel syndrome? Is it going to be A, blood in the stool? Remember, it says common symptom. So what would you see as a CNA? Is it going to be A, blood in the stool? B, severe weight loss? C, abdominal pain relieved by defecation? What is defecation? Or D, persistent fever? All right, so Miss Mary has been admitted to your unit in the hospital. She has dehydration because of the irritable bowel syndrome. She's not keeping anything down. She doesn't want to eat because every time she eats, guess what happens? Yes, you are absolutely correct. C, abdominal pain, that then she can only relieve that pain by having a bowel movement, by defecating. So it is a horrible cycle. So irritable bowel syndrome, or IBS, often presents with cramping, bloating, and changes in bowel habits, which with pain typically relieved after passing the stool. So imagine if every time you eat, it hurts so bad until you have to have a bowel movement. Are you retaining any nutrients? These patients can be a little irritable. Of course, they're going to be tired. They're going to be sometimes pale because they're anemic. And so it's just a lot of things that go on with having IBS. Which condition involves the formation of small pouches in the colon wall? Well, we know it's not appendicitis because we already know what that one was. That was inflammation of the appendix. So is it going to be B, Crohn's disease, C, diverticulosis, or D, ulcerative colitis? And we even have talked about ulcerative colitis. So in one video, I had you work a whole 12-hour shift with patients who had multiple diagnoses. So I hope that this helps you. I can read questions to you all day and all night long. But when you get your first job and you have 15 patients with 15 diagnoses, do you know what those diagnoses mean? Do you know how to watch out for those patients? So that's the purpose of this video, because a good CNA not only saves the patient's life, but they also save the nurse's license and the doctor's license. So revealing the answer in 3, 2, and you all, it is C, diverticulosis. Like they shouldn't be eating nuts or popcorn because those popcorn kernels, the seeds could actually get stuck in one of those pouches and cause more pain. So diverticulosis is the presence of small pouches in the colon, which can become inflamed. So if someone has a diet of diverticulitis or diverticulosis, don't give them nuts and peanuts, etc., because again, they can get stuck and cause them to have a worsening of their painful condition. Gallstones. All right. Oh, yeah, I need to do a video on kidney stones too, but this one's on gallstones. So, what is the most common symptom of gallstones? Is it A, severe pain in the upper right abdomen, B, black tarry stools, C, persistent diarrhea, or D, blood in the urine? Gallstones. What do you think, team? I'm gonna wait for a few more responses. Great job. We'll reveal the answer in 3, 2, and it is A, severe pain in the right upper abdomen. So gallstones can block bowel ducts, causing severe pain, especially after eating fatty foods. So have you realized with a lot of the gastrointestinal challenges or conditions that a patient has, it can be treated by food, by dietary changes. So not everything requires medication. All right, so our next one, which condition is caused by chronic liver damage? Is it going to be hepatitis A, cirrhosis, pancreatitis, or diverticulitis? Read that question well. So what would be a disease, a chronic disease of the liver? And if someone had this chronic disease, what condition is caused by that chronic disease? And so a chronic disease that affects the liver could be hepatitis. And if someone has hepatitis for years, what's going to happen to them? They're going to end up getting cirrhosis. So if you got B, great job, applause to you. Cirrhosis results from chronic liver damage, often due to alcohol abuse, hepatitis, or fatty liver disease. Which symptom is often associated with pancreatitis? And I'm just going to make this easy. When someone has pancreatitis, they are in severe pain. So this one's going to be C, severe upper abdominal pain radiating to the back. And so they have to get treated ASAP because we're always concerned about, an organ or the pancreas rupturing. They may need it removed emergently if we can't treat them with antibiotics and pain medicines and fluids. Our next one. Which gastrointestinal infection is associated with prolonged antibiotic use? All right, so Mr. Lucas with MRSA has been on your unit for 2 weeks. He's had IV antibiotics now for 2 weeks. What do we think is going to happen to him? Is he going to have A, an H. pylori infection, B, esophageal cancer, C, hepatitis B, or D, Clostridium difficile, or C, diff? Which infection occurs because of prolonged antibiotic use? Revealing the answer in 3, 2, and ding, 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 ding. You are right. It is C. diff. The answer is D. C. diff infections occur after prolonged antibiotic use because those antibiotics kill all the bacteria. They don't like, hey, I'm just going to kill the bacteria in the bloodstream. It's going to kill the bacteria in the gut, also in the stomach. And once that bacteria in the gut is killed, that means that the yeast, the viruses, everything else, there's an overgrowth, and there could be an overgrowth of E. coli, of C. diff, which causes a very contagious and foul-smelling diarrhea. So if you notice someone has a foul-smelling diarrhea in your facility, please let your nurse know. Not all diarrhea is the same. So there is stool that stinks, but there's stool that stinks like the way C. diff stool stinks. And so once you encounter it once, you'll know exactly what I'm talking about. That person has to be put on isolation, and of course your nurse will require you to collect a stool specimen that will be sent off to lab for confirmation. But just protect yourself when you're making the bed. Make sure your legs are not touching. Make sure you have on gloves and that you provide proper hand hygiene. What is a key symptom of a gastrointestinal bleed? Is it A, bright red blood in stool or vomit, B, persistent diarrhea, C, frequent heartburn, or D, painful swallowing? A symptom of a gastrointestinal bleed. This one is super easy because we know if something is bleeding, then we expect to see something red. And there are two different types of GI bleeds. So when it says upper, like let's talk about maybe like the esophageal bleeds. And so that's when you'll see bright red blood or the hematosis, the vomiting of the blood. If it's been digested, if it has mixed with bile or gastric juices, it may be black and tarry. Another time that you will see red is if it's on exit. So let's say it's hemorrhoidal bleeding. Well, that's when it'll be red again. So if it's upper, it's going to be red. If it's mid, it's mixed with digestive juices, it's going to be black and tarry. If it's lower, it may also be red. So anytime something's abnormal, you're going to notify your nurse. Don't scare your patients. Just say, hey, is this your normal? And as soon as they say no, get them back in that bed, press that button, get that nurse in the room. What is the CNA's primary responsibility when assisting with a wound culture collection? Do you A, label and transport the specimen correctly? B, swab the wound for the culture? C, interpret the lab results? Or D, administer the antibiotics after the culture? What is your job as a CNA? 15 patients. Your nurse calls you in the room to help with the wound culture. What do you think the CNA does? And I know you're super smart, so you know that a CNA does A. They're going to label and transport. So CNAs may assist by ensuring proper labeling and timely transportation of the specimen. Take it to the lab while swabbing the wound. Interpreting the results and administering antibiotics are outside of their scope of practice. Even though that part is outside of your practice, what you do is so important, because if no one ever takes a urine culture to the lab, if no one ever takes the stool to the lab, the sputum to the lab, then the patient won't get better because we won't have those results, those tests. So you do collect some specimens, but as far as a wound is concerned, that's usually the nurse that has to go into the wound and do the actual swabs. A CNA observes a wound with green, foul-smelling drainage. What should the CNA do? A, clean the wound immediately. B, notify the nurse promptly. C, apply a new bandage and continue care. D, ignore it as this is a normal drainage. Green, foul-smelling drainage. Well, that just sounds horrible. So we're going to go ahead and do B. We are notifying the nurse. Green, foul-smelling drainage may indicate infection and must be reported to the nurse immediately. Cleaning or applying a new bandage without direction is outside of the CNA's role. All right. Now we've talked about all of these gastrointestinal conditions. What is the purpose of a colonoscopy? You have to give your patients prep. So this patient has had bowel cleansing medication all night. They have drank a gallon of a laxative. Okay, so that way when the doctor goes in, what is the doctor trying to see during a colonoscopy? Are they detecting the gallstones? Are they examining the liver? Are they screening for colon cancer or polyps? Or are they treating stomach ulcers? What is the purpose of a colonoscopy? Colon, we know what that is. The scopy part means they're taking a flexible camera and they're going to be scoping. They're going to be looking like telescope. So if you chose C, I'm so proud of you. You know that a colonoscopy screens for cancer and polyps, and it's used to also identify other abnormalities within the colon. Our next one is, which intervention is recommended for constipation? So your patient has not defecated. They have not had a bowel movement. Do you want to A, encourage a low fiber diet, B, increase fluid intake and activity, C, limit physical activity, or D, promote fasting for 24 hours? How are we going to get Mrs. Lucas to move her bowels? If you chose B, you are absolutely correct. We're going to increase the fluid. We're going to ask her to get up. Let's go for a walk, Miss Lucas. Let's pass some gas. Let's sit on the toilet. But what we're not going to do all day is lay in this bed. And that should hopefully get the stomach muscles, peristalsis, get them moving so that she can get some action and she can actually have a bowel movement. So get her up, give her fluids. What is the most common symptom of hepatitis B? Is it going to be severe chest pain, a rash on the abdomen, yellowing of the skin and eyes? We call that jaundice, or numbness in the extremities. What is a common symptom of hepatitis B? Revealing the answer in 3, 2, and yes, everybody, look at that image. It is C, yellowing of the skin and the eyes. We refer to that as jaundice. So hepatitis B affects the liver, often leading to jaundice, which is due to the buildup of bilirubin. And so their skin will turn yellow. And of course, their sclera turns yellow also, or the whites of their eyes. What is a symptom of cholecystitis? Is it pain in the left lower abdomen, severe pain in the upper right abdomen, cramping in the intestines, or D, acid reflux? Cholecystitis, what in the world are we talking about? I'll give you 5 seconds to see what your answers are, and then we will reveal the correct response. All right, 4, 3, 2, and Cholecystitis refers to inflammation of the gallbladder. So great job. It is B. Severe pain in the upper right abdomen. Remember where the gallbladder is located, and sometimes they may have deferred pain. So it's not exactly or directly on top of the organ. But if it's severe right upper abdomen pain, your doctor is going to be thinking of maybe pancreatic pain and or the gallbladder being inflamed. And we know that the way that we're going to help decrease their pain is by encouraging them to eat a bland or a low-fat diet. What is the priority for a patient with a C. diff infection? All right, so we talked about C. diff earlier. Foul smelling diarrhea. What is a priority for the patient? Is it going to be A, isolation and contact precautions? Is it going to be B, encouraging a fluid restriction? C, avoiding all medications? Or D, frequent repositioning? You are absolutely correct. Yes, it is A, isolation and contact precautions. Remember, it's contagious. So we're going to have to put on our PPE and we have to put a sign on their door. Normally, they won't do that until you sent off the specimen and the lab has confirmed that they have C. diff. But at that point, that person's on isolation. And of course, we're gowning up, we are gloving, and we are making sure that we extra wash our hands. With C. diff, we can't use hand sanitizer because the C. diff is kind of encapsulated, so the sanitizer cannot penetrate the core. And so the best thing to do would be to wash your hands with warm water and soap, because the friction should, of course, scrub it off your hands, and the water should allow it to rinse off. And when you turn off your water, make sure you use a napkin to turn off your water so you do not recontaminate your hands. What is a common symptom of fluoride deficiency? Eunice, what are you talking about? Look, you're taking care of everybody from birth to death, from 0 day to 120. All right, so if someone has a fluoride deficiency, what do you expect to see? Is it going to be brittle hair, dry skin, joint pain, or dental cavities? That's so easy. We're not going to delay. It is going to be D. They're going to have dentation issues. They're going to have cavities because fluoride helps to strengthen the teeth, which is why a lot of our toothpaste has fluoride in it. Which food is most likely to trigger gallbladder pain? So a patient has a diagnosis of cholecystitis, and we have advanced their diet slowly. Their pain has resolved, and the doctor says, okay, you can eat whatever you want. What should that patient order? Should it be A, green leafy foods, B, whole grain bread? Excuse me, what should they avoid? Not what should they order. Should it be C, fried or fatty foods, or D, berries? All right, so what should this patient avoid when they're ordering from the menu? And you are correct. It is C. They should not be ordering the fried chicken, the hamburgers, none of that, because it's going to take extra bile in order to digest that food, which is going to cause their pain to increase. So fatty foods stimulate bowel release, which can cause pain in the gallbladder if it is inflamed or blocked. So just remind them of their dietary concerns. Hey, you can't have everything you want, Miss Eunice, because it's going to make your stomach hurt. Why is it important to report increased wound drainage? A, it always indicates healing. B, it may suggest infection or delayed healing. C, it requires no action unless it's purulent. D, it is not part of a CNA's responsibility. Why are you reporting increased wound drainage? Because you're reporting it because you care about your patients and you know that that means that that wound isn't healing. It could be a worsening of the infection. So, it is B. Increased drainage can be a sign of infection, delayed healing, or other complications and must be reported for timely intervention by the nursing team. And looks like we only have about 10 questions left. I'm so proud of you. What is the CNA's primary role when a patient is experiencing nausea and vomiting? Is your role A, to administer anti-nausea medication, B, to provide small sips of water without approval, C, measure and report the amount of vomit, D, withhold all fluids indefinitely? What do? Patient's nauseated. She vomits. What does the CNA do? And if you chose C, yes, we just don't give them a basin, they vomit, and then we pour the vomitus into the toilet. No, it has to be measured because remember, what goes out should match what comes in. Otherwise, your patient's going to be dehydrated. So we're going to do C. We're going to measure and report the amount of vomit. Reporting could just be as simple as you putting it in a chart, document it, then you let the nurse know in passing. But if this person has a large amount of vomitus, you need to let that nurse know right away, especially if this person doesn't have any IV fluids flowing, because that means this person is going to be dehydrated. So CNAs are responsible for measuring and documenting the amount and the appearance of vomit promptly to the nurse. Of course, we know that medication administration is not within your scope of practice, so you would not be giving them medications to stop the vomiting. What is the function of the proton pump inhibitors? All right, so this one is a nursing question, but hey, if your patient has GERD, they have acid reflux, they're going to be like, hey, where's my pill? So what does a proton pump inhibitor do? Does it A, increase stomach action production, B, reduce stomach action acid production, C, neutralize toxins in the liver, or D, treat bacterial infections? And yeah, this one was a nursing question. You got me on this one. So everybody, the correct response, which I know you know it, even though it is a nursing question, it is going to be B. We're going to reduce the stomach acid production. Our next one, what symptom is associated with vitamin D deficiency? Why do you care about vitamins, Miss Eunice? Because your patients are lacking vitamins. They're eating foods. They're eating empty calories. They're drinking alcohol. They have so many different stomach concerns. So we have to know about their vitamins and their deficiencies. And how would you know when to tell the nurse something's wrong with the patient if you don't even know what you're looking for? So a vitamin D deficiency does it cause A, night blindness, B, unexplained bruising, C, cracking at the corners of the mouth, or D, rickets or osteomalacia? And I just like introducing you all to new content. I love it. So the answer is D. And I know you're like, Eunice, what is rickets? What are you talking about? Look at this picture, you all. I know you've seen it. You just didn't know what it was. So it is D, rickets. So vitamin D deficiency can lead to rickets in children and osteomalacia in adults, both characterized by soft and weak bones. So when you see that abnormal bowing of the leg, or somebody who may be like a dwarf, that could be a sign of rickets. They may have bone pain, delayed growth, those bowed legs, large forehead, trouble sleeping, dental deformities, and muscle weakness. So now when you see someone, of course, we don't try to diagnose people, but if you see somebody with bowed legs who may have a shorter stature, you're now going to know what we mean when we say they have rickets. What is a common symptom of vitamin A deficiency? Is it brittle nails, night blindness, muscle cramps, or frequent colds? Revealing the answer in 3, 2, and when someone has a vitamin A deficiency, night blindness is going to be B, because vitamin A is essential for vision, and its deficiency can impair the ability to see in low light. Our next one, you're going to get this one. This one's easy. Which vitamin deficiency causes scurvy? Is it A, vitamin A, B, vitamin D, C, vitamin C, or D, vitamin K? And there's no way any of you are going to get this one wrong. So I'm revealing the answer in 3 seconds. 3, 2, and you are right. It is C, vitamin C. So scurvy results from a lack of vitamin C, leading to symptoms such as bleeding gums, bruising, and joint pain. Fortunately, we don't have that a lot in today's times because a lot of our foods are fortified with different vitamins. But again, if you go to another country or if you're caring for a patient from another country, it's important for you to know what to look out for. Which symptom is associated with a vitamin B12 deficiency? Why are people taking B12 injections? Why are they doing B12 sublingual drops? What does B12 do? All right, so which symptom is associated? Is it going to be A, fatigue and tingling in the hands and feet, B, brittle bones, C, dry, flaky skin, or D, hair loss? B12 deficiency is linked to what? It is linked to anemia, everybody. So the answer is A. When someone is anemic, when they don't have enough oxygen, the red blood cells, they're going to be tired and they're going to have tingling. So vitamin B12 deficiency can cause anemia and neurological symptoms. Our next one, let's see if you can get this one. I know you're going to get this one because we talked about it last week. What is the primary symptom of vitamin K deficiency? Vitamin K deficiency, is it keloids, muscle weakness, hair thinning, or easy bruising and bleeding? So if someone's not eating enough vitamin K, enough green leafy vegetables, what are they going to be at risk for? And my team, I see you. I see all these great answers. And yes, the answer is D, bruising and bleeding. So vitamin K is essential for clot formation. No vitamin K, no clotting. So its deficiency can result in prolonged bleeding. So we say someone has hemophilia, they have a bleeding. If a patient gets a little nick or a cut on them and they're just, it's like, oh my God, I got to hold pressure for 3 minutes for a little nick. You want to be thinking about, oh my, this patient probably either has a platelet issue or they have vitamin K issues. All right, so here we go. Our next one, team. Thiamine. So anytime I think of thiamine, I think of someone who's an alcoholic. So let me go back and read this one. Which symptom is a hallmark of thiamine deficiency? Is it going to be A, peripheral neuropathy and confusion, B, brittle hair and nails, C, poor night vision, or D, dry, scaly skin? Think of the person who is on drugs or who may be an alcoholic. They're not eating well. They have liver issues. When they come to your facility, they're going to get a bag of fluids that have all types of nutrients in them. And one of the bags is going to contain the thiamine because A, they can start having confusion and peripheral neuropathy, especially if your facility does not allow them to drink alcohol while they're in the facility. Some facilities do because we're not there to detox them. They came in the hospital for wound care and we know they're alcoholic. We don't want them going into withdrawals, but every facility is different. And so they will usually have a thiamine drip, or some type of drip that contains thiamine. So thiamine deficiency can lead to Wernicke's encephalopathy characterized by neurological conditions. You don't want those patients going into DT or delirium. What is a symptom of riboflavin, vitamin B2 deficiency? This one was hard for me. I had to go back and look at my old books for this one. Is it going to be A, cracks at the corner of the mouth? Is it going to be B, weak bones? C, numbness in the extremities? Or D, pale skin. And because this one was hard for me, I'm just going to go ahead and go to the correct response. And if you get it right, please applaud yourself because obviously you have studied. You are probably in nursing school taking your CNA test so you can work as a CNA while you're waiting to pass your NCLEX. And so reveal the response in 3, 2, and yes, you all, it is A. Riboflavin deficiency causes the cracks at the corner of the mouth. Ouch. It can also cause glossitis, which is an inflamed tongue, and also other oral sores. And I just feel so sorry for this person, but we are going to replace that riboflavin, give them a drip, give them a tablet, give them some food so that we can cure this condition. All right, so it looks like I went the wrong direction. I apologize. Let me go here. All right, so my CNAs, 15 patients you've taken care of today. Very good job. This next question, a patient with dehydration due to vomiting is at risk for which of the following complications? Mr. Michael has been vomiting now for 2 days. He hasn't stopped. We have him in PO, which means he can't eat or drink anything. He's still vomiting. We're going to have to put an NG tube in him. Okay, we're going to have to connect that to suction. But what is he at risk of? Is it going to be A, increased energy levels, B, kidney failure, C, enhanced appetite, or D, improved skin elasticity? We don't expect him to improve anything. So it's not A, C, or D. If we don't stop that nausea and that vomiting, it can become so severe until he can go into kidney failure. It could be B. Severe dehydration caused by vomiting can lead to kidney failure by reducing the amount of blood flow to the kidneys. Hey, the blood needs fluid. If they're vomiting everything up, there's not enough fluid. The blood's going to become concentrated. That can impair the ability of the kidney to filter the waste, ultimately leading to acute kidney injury or AKI. That's why my CNAs are awesome, and they're going to notify those nurses. If you're not telling some of these nurses, especially if you're in a nursing home, and the nurse can have 30 patients and she's barely seeing the patients at all because she's so busy, you are the eyes and the ears of the nurse. Get someone in. Don't be afraid to say something. Report it to your nurse and make sure you document it so that your patient doesn't go into kidney failure. All right, so a symptom of folate deficiency. When you think of folate, what are you thinking of? Is it skin rashes, hair loss, impaired night vision, or megaloblastic anemia? And because I have that big fancy word there, you got to know it's the big fancy word. And so, yes, it is D. What in the world is megaloblastic anemia? Meg is big. All right, so megaloblastic anemia. Folate deficiency leads to megaloblastic anemia, a condition where red blood cells are abnormally large and underdeveloped. And looks like we're on almost our last question here. Which symptom is common in vitamin E deficiency? Is it going to be neurological problems such as poor circulation, muscle weakness, fragile bones, or pale skin? Vitamin E deficiency. And no, your test is not going to be asking you about vitamin E deficiency, about riboflavin. I am preparing you for what you're about to encounter after you pass this test and you have 15 patients in the facility and things are happening fast. And I need you to think back to these videos, like what did Nurse Eunice say? And so for this one, it is A. It is a neurological problem such as poor coordination. Our next one, which deficiency causes anemia and hair loss? Which deficiency causes anemia and hair loss? Is it vitamin D deficiency, vitamin B12 deficiency, an iron deficiency, or a zinc deficiency? And this oftentimes can happen after pregnancy. So think about some of the nutrients and the vitamins that we give those, especially during their prenatal period. And I'm revealing the answer in 3, 2, and it is going to be C. You got it right. It is iron. So an iron deficiency causes anemia also, and that can cause the thinning of the hair and fatigue. All right, and so let me go back. I went that one too fast. An iodine deficiency, which is why a lot of your salt is iodinized. So if we don't have any iodine in our system or iodine in our system, it's going to be A. It can cause a goiter. And if you've never seen what a goiter looks like, it causes an enlarged thyroid gland. As you see here, the person has this mass in their thyroid area, and we refer to that as a goiter. And it's usually caused by a lack of iodine, and the thyroid needs the iodine in order for it to function. All right, so this is going to be our last question, team. I'm so proud of you. You did a great job. Happy Wednesday. So a CNA is monitoring a patient's fluid intake and output. What is included in the output measurements? In other words, what fluids do you actually measure? Is it going to be vomit and urine? A. Is it going to be B, only urine output? Is it going to be C, vomit, urine, blood, and diarrhea? Or is it going to be D, only vomit and sweat? As a CNA, what bodily fluids would you measure? And I'm revealing the answer in 3, 2, and you measure all of it. So it's going to be vomit, urine, blood, and diarrhea. So sometimes your patients have surgical drains. We call them the Jackson Pratts. So whenever you are emptying out that drain, you just don't empty it into a toilet. You're going to enter it into a smaller collection device that has a little measurement lines on it, so you can measure. If someone has had surgery, we expect more blood loss on day 1, and it should gradually subside. But if you are constantly emptying out this bulb and it's always full, that would be a sign that that person is still not properly healing. So what you do matter. You measure urine. You measure all the liquids that come out of someone's body, including the fecal matter. And if you don't understand how to do so, you can always just send us a message and I'll explain it to you. But they have little collection devices that you place in the toilet, one in the front, one in the back. It has lines in it. And if it's a solid bowel movement, you'll just mark the person had one bowel movement. But if it's diarrhea and it's liquid, you actually document it in cc's or ml's, whatever your facility has asked for. And so everybody, I want to thank you all for staying with us for this long. We have covered 100 CNA practice questions. Again, this one wasn't so much test specific. This one was the one to help you get prepared to those patients with those diagnoses that you're going to see when you take care of them on the units in the nursing homes, etc. So this is Nurse Eunice. We have freebies on our website, fltraining.com. I'm going to try to come back on Sunday and do a funner video, or at least something that I think is fun. And so if you have any questions, comments, you can send us an email to admin, ADMIN, at fltraining.com. You can also do your free downloads at fltraining.com. So I appreciate you, and I thank you all for being here for a Wednesday night live, a 2-hour review. And I thank you so much, and have a great night, everybody. Bye.